Hi everyone, today we will talk about the depression. We will cover depression in four parts. For the first part, we will discuss what is depression and the background. First, let's take a look at depression through a video.
We all feel sad or upset sometimes. We all have tough days or even think about suicide. But when we feel down day after day, feel less than or unlovable, when life seems pointless, like we're living in a black hole and can't find a way out, we may be feeling depressed or have clinical depression. Depression can look different for each of us. We might sleep too much or too little, eat too much or too little, lose interest in the world around us, cry a lot, have low energy and trouble concentrating, even think about self-harm or that we might be better off dead. Sometimes even being around friends and family or going through a happy time doesn't help us to feel any better. But depression is both common and treatable. If you feel down or think you may have depression, please visit adaa.org for free resources and use the Find Your Therapist tool to find support near you.
What is depression? Depression is a state of low mood and loss of interest in daily activity that can affect a person's thinking, behavior, motivation, and overall well-being. It can be either a normal response to life events or symptoms of certain mood disorders, such as major depression disorder or persistent depression. One is the major depression, and other is the long-term but mild symptoms. But how to make a diagnosis based on symptoms? We have two criteria. The first one is DSM-5. A major depressive episode is defined by the presence of five or more than the following symptoms during the same 2 weeks period. At least one of the symptoms must be either depressed mood or loss of interest or pleasure. This is his diagnostic classification, including depressed mood, markedly diminished interest or pleasure, significant weight loss, and so on. The second one is the ICD-11, and the diagnostic criteria are also divided into 9 categories, similar to the DSM-5. Both of the DSM-5 and ICD-11 emphasize that these symptoms must cause significant distress or impairment in social, occupational, or other important area of functioning and cannot be attributed to the physiological effect of the substance or other medical condition. For different ICD-11 classified as mild, moderate, major depressive episode. The specific use can be selected according to the situation. Next, let's take a look at the background of depression. The first one we could see the global prevalence. According to the WHO, established that 5% of the adults worldwide suffer from depression. There are about 280 million people worldwide suffer from depression. The gender difference, women are more likely to develop the depression than men. The adolescent, the prevalence of non-suicide self-injury among adolescents is 19.5% globally and 62.2% among those with depression. Well, about the cause of the disease, the cause of depression is thought to be the result of the interaction of multiple factors, including the genetic, neurobiological, psychological, and the social environment. New research has found that the pre-striatum of the brain is significantly enlarged in people with depression, which may be a risk factor of depression rather than a result. In addition, the study found that the young depressed patients had different pattern of the functional brain connectivity than adults, suggesting the need of specific treatment strategies for adolescents. About therapists, the traditional treatment for depression including antidepressants and psychotherapy. About the psychotherapy, we will talk about the three. The first is cognitive behavior therapy, CBT. By identifying and changing negative thinking and behavior patterns, patients are helped to establish a more positive way of thinking. Second one is interperson therapy. It is especially suitable for depression caused by interpersonal conflict. The third one is the mindfulness-based cognitive therapy, a combination of meditation and cognitive behavior techniques to prevent relapse. In addition, we have made some new discoveries. The, the new study has found that the patient has self-administered PDCS at home to realize symptoms of depression effectively. The normal therapies enlarging neuroplasticity will assist for their effectiveness and mechanism in treating depression through digital intervention like apps. Next, we will present we will present a case to illustrate depression in detail. Client Xiaowen is female, 13 years old, a first grade student, introvert, and has a brother. No history of the major physical illness, no family history of mental illness. Xiaowen grew up in Guangzhou and moved to Nanjing in the fourth grade due to his parents' work. Due to cultural difference and language barriers, Xiaowen's study and life in Nanjing didn't adapt well, and his performance were always at the middle level. This is Xiaowen's subjective description. Some symptoms appear. For example, depressed mood, self-harm behavior, insomnia, strained relationship with parents, and has a narrow social circle, sensitive, low self-esteem. Corresponding to the depression symptoms mentioned earlier, further judgment can be made. Okay. Based on the client characteristics and subjective description, we summarize the need of the clients in four aspects. First, learning and life adaptation. She needs to adjust her study status, improving her work and life, and improve her study efficiency. Second, improving family relations. She needs to improve communication with her parents and get more family support and understanding. Third, social support society symptom establishment. She needs more understanding and support from family, social society to help her out of the dilemma. Fourth, self-recognition and acceptance. She needs to rediscover herself, accept her strengths and weaknesses, and build a healthy self-identity. Okay, next part, more specific analysis will be combined with the model.
Okay, today I want to share a promotion plan we will develop to support Xiaowen's mental health. This part includes goals, details, and specific strategies. Let's look at goals. Emotional management, improving family and social relationships, and learning enhancement. Let's dive into the details and specific strategies. Let's talk about emotional management. First up is the self-empowerment model. Think of this as giving Xiaowen the tools to take control of her own well-being. We are teaching her specific skills like deep breathing and mindfulness meditation, simple things she can do daily, even in bed. For example, a 5-minute morning breathing exercise helps her stay grounded. We are also setting goals together. Small wins like write down one happy thing each day build confidence, while bigger goals like reducing self-harm are approached gradually. And here's a creative twist. Since she loves Japanese literature and comics, we are encouraging her to express emotions through writing stories or art. This not only channels her feelings positively, but also helps her develop new skills. Next, we are using the broaden and build theory. The idea is that positive emotions expand our thinking and help us build lasting resources like social connection or resilience. One powerful practice here is gratitude. Every day, Xiaowen writes down 3 things she's thankful for. It could be as simple as sunshine through the window or a friend's smile. This shifts her focus to positives, even on tough days. Why does this matter? Research shows grateful people report higher happiness and lower stress. Plus, it creates a ripple effect. When you feel grateful, you are more likely to reach out to others, which strengthens relationships. Finally, we are incorporating mindfulness and self-compassion. Mindfulness helps her observe emotions without judgment, like noticing, I feel lonely right now, instead of getting stuck in it. Self-passion has 3 parts. Being kind to herself, like, it's not my fault. Remembering others share similar struggles, like, I'm not alone, and staying present with her feelings. For example, if she feels ignored, she might say, Xiaowen, it's okay to feel hurt. Many people experience this, and I can ask for help. Okay, that's all. Next part.
The second target is family and social aspects. Use the socio-ecological model to gradually establish a support system. Let's discuss from a family perspective. Improve the relationship with Xiaowen's mother. Give 5 minutes of positive feedback every day. For example, you cleaned the room today, which is great. Mom made a delicious dinner today. Try to write a letter of gratitude to her mom. Because her father isn't easy to communicate with, try to communicate calmly with her father. If she cannot communicate, she can ask for help from professionals such as family therapists or social worker. From Xiaowen's own perspective, it is possible to record emotional diary, record the conflict events and own reactions, and analyze them using the ABCD model, such as my father scolded me. I thought I was incompetent. It was actually his pressure projection. From the social perspective, the social competence framework was proposed by Goldman as part of the theory of emotional intelligence. It emphasized the importance of social skills in personal success and effective interpersonal relationship. The framework is divided into 3 main parts: social awareness, social skills, and relationship management. From the perspective of relationship management, building bonds, the principle of reciprocity, Xiaowen can actively provide more help to classmates at school, such as borrow notes, sharing snacks, to increase goodwill. At the same time, she can find interest groups related to Japanese literature on the internet to participate. Share own thoughts on books. This will help her improve relationship with classmates. The third theoretical construct is man's search for meaning. Frankl made a core point. Human search for meaning in life is their most basic motivation. People can discover meaning in 3 different ways: creating a work or doing a deed, experiencing something beautiful or loving someone, finding meaning in suffering and even hopeless situation. Xiaowen can shift her focus from herself to helping others and enhance her sense of value by participating in volunteer activities or creative projects, such as serving as a Japanese language enlightenment teacher at a community center or sharing Japanese literature. She can also simply record the beautiful moments with her classmates during the daily break, such as Lily taught me how to do the questions today. When encountering conflicts with classmates, Xiaowen can try to think about what experience did I gain from this incident and accept her own imperfections. Next part.
Now that we delved into the problem-solving training idea model and how it's applied in Xiaowen's learning improvement strategy, idea model includes 5 steps. The first one, identify learning difficulties and define the problem. Next is explore solution and act on strategy. In the end, look back and evaluate. In Xiaowen's learning improvement strategy, this model is used to help her identify learning problems and analyze causes, develop learning plans, implement learning methods, and evaluate learning results gradually, solving problems encountered in learning and improving her academic performance. Let's shift our focus to another important aspect: cognitive reframing ABCDE model. ABCDE model is a psychotherapy technique designed to help people change negative or irrational way of thinking. Xiaowen will spend 20 minutes every day writing in a diary at desk. Recording frustrations, Xiaowen can do this at home or in the library. After talking about the time and place for implementing cognitive reframing, let's take a closer look at the specific implementation steps and example of the ABCDE model. Step A, activating events. Identify the triggering events. The action is record the specific event that triggered the low mood that day, such as my father criticized my grades and my test scores were very poor. And step B, belief. Analyze the automatically generated beliefs. Action is write down the explanation and thoughts about the events, paying special attention to irrational beliefs. For example, Xiaowen may think, I am stupid, I can never do anything well, and everyone will look down on me. And in step C, consequence. Record emotions and behavioral consequences. Action is describe emotions such as sadness, anger, and behavioral reactions such as avoiding learning, self-harm impulses. Xiaowen may feeling desperate, hiding in the room crying and not wanting to work hard anymore. In step D, dispute. Challenge irrational beliefs. Action is use evidence to refute the belief in step B and ask, are there exceptions? I got 80 points in the last English test, which means I am not never doing well. My father's evaluation of me is not my true value. Xiaowen can think. And step E, effect new belief. Establish a new belief. Action is replace the negative belief in step B with more reasonable and specific statements. For example, my poor grades mean I need to improve my approach. Now, not that I am a failure. I can ask my teacher for help and make a review plan. Through the previous introduction, we have grasped how the idea model solves learning problems and the ABCDE model transforms negative thinking. They support personal growth. These aren't just theory, but practical tools. Next, let's enter part 4, conclusion and questions, to summarize and discuss practical issues.
The fourth part, conclusion and questions. The first is the concluding remark. Xiaowen, a depressed teenager, struggles with emotions, family, social life, and academics. Our strategy focuses on emotion management, social skills, and learning improvement to help her regulate emotions, reduce depression and self-harm, build healthy relationships, and enhance academic performance. With support from herself, family, and society, Xiaowen can overcome depression and regain hope and happiness. Finally, questions related to our presentation. If family intervention, such as communication with father, is difficult to achieve in a short time, What specific measures can schools and social support systems take to replace or supplement the lack of family functions? That's the end of our presentation. Thanks for your watching.